So thank you. And I'd like to begin by just saying a thank you to Purina and to the Purina Institute for the opportunity to share with you today. And we're going to look at the potential medical benefits from a higher water intake in cats. And I think this is an interesting topic. We know that cats are pretty good at maintaining hydration. They are efficient, they concentrate urine very well, and cats can, in fact, in the wild at least, meet pretty much all of their water needs from the diet. There have been studies that have shown that quite nicely. So cats are efficient when it comes to maintaining hydration. When it comes to pet cats, of course, they are not fed a wild diet. We typically feed them dry cat food or wet cat food. And there are advantages and disadvantages with both of these. Neither of them mimic a natural diet, but then going to the supermarket and buying prepared foods doesn't mimic a natural diet for you and me, but it's still good nutrition. When it comes to dry cat food, we know that that has some benefits in terms of maintaining oral health, and it's much easier for owners to hide kibble around the house and make it interesting for cats to go and find food and to forage and perhaps browse, eat during the day. With wet foods, there is a texture to wet foods that some cats certainly prefer, and obviously they have a higher moisture content. So typically, wet food would have around about 80% moisture content, and a dry food around about 10% moisture content. That difference in moisture content of food also carries through to the amount of total water that a cat will take in when they're fed different diets. So the graph here on this slide summarizes 4 different studies that compared total water intake when cats were fed dry diets, the blue bars there, dry diet less than 10% moisture, compared with a wet diet around about 75 to 85% moisture. And you can see that the total water intake is always higher with a wet diet. Not every study has shown that, but most studies show that total water intake when a cat is fed a wet diet is higher than when a cat is fed a dry diet. Certainly with a dry diet, cats need access to water. They will drink, and they will drink the volume of fluid that they need, but total water intake is higher generally with a wet diet. That isn't necessarily reflected in increased urine output or indeed in a lower urine concentration, because it depends on a number of other factors as well: digestibility of the food, the composition of the food, the electrolyte concentration, the protein concentration, etc. So that doesn't necessarily reflect urine characteristics, but we're looking here at total water intake. So why is that important? Well, cats have been reported to be relatively insensitive to dehydration. Certainly, there are some old studies which suggest that when a cat becomes dehydrated, its drive to drink to replace that water that has been lost is somewhat lower than a dog. So they're not as quick to replace lost water as a dog. So they are perhaps, as a species, relatively insensitive to dehydration. They generally produce very concentrated urine, of course, and most of the time there is no problem with this at all. We know in humans and rats from studies that have been done that the aging process itself leads to a poorer thirst drive. And there is some evidence that that may be true in cats as well. So particularly older cats, and combined with this relative inherent insensitivity to dehydration, there may be a predisposition to hypohydration, so underhydration potentially, particularly in older cats. Well, the important thing is obviously, where might this be clinically relevant? Most of the time, this is not a problem for a cat, but there are situations where water intake might be considered critical for health. So we'll just go through and have a look at a few of these particular conditions and problems. First one that comes to mind is chronic kidney disease. We know, of course, that chronic kidney disease is a common problem in cats. The graph at the top of the slide there, that's from data that was collected by the Vet Compass survey in the UK. This is an epidemiological group that is set up at the Royal Vet College in London, looking at large data that's been collected from first opinion practice. Looking at cats over 5 years of age, they identified that renal problems, chronic kidney disease primarily, is the second most common cause of death in cats over 5 years of age, second only to neoplasia or mass lesions, accounting for the death of around about 14% of cats over 5 years of age. We know that chronic kidney disease tends to be a disease of older cats. It may affect more than 30 to 40% of cats over 10 years of age, and as the cat gets older, the risk increases. And of course, chronic kidney disease is associated with obligatory diuresis. The kidneys lose their ability to concentrate urine so well, so there's an obligatory diuresis, and that means that dehydration is quite commonly seen in cats with chronic kidney disease. Summarizing 4 different studies that have been published in the literature looking at clinical signs, presenting clinical signs of cats with chronic kidney disease. In fact, dehydration was the most common reported sign. Over 60% of those cats were reported to be dehydrated on initial presentation. So this diuresis leading to dehydration is a common problem with chronic kidney disease. The International Society of Feline Medicine developed some consensus guidelines on diagnosis and management of chronic kidney disease. These were published in the Journal of Feline Medicine and Surgery. They're freely available on the journal website. But what they noted was, again, CKD leads to variable diuresis. Dehydration is common. And so this is a really important feature to address with chronic kidney disease. If a cat is dehydrated, that needs to be corrected, often with intravenous fluids initially, perhaps. But then we need to look at the ongoing maintenance of those cats. We need to maximize their voluntary water intake. The recommendations were free access to different water sources, using a wet food rather than a dry food to try and increase total water intake, and consider adding water to the diet. Importantly, they noted in that document, the consensus guidelines, that maintaining hydration, certainly there is evidence that that leads to improved quality of life for these cats. It may well lead to improved longevity as well, decreased progression, but studies haven't been done to actually document that. Second clinical condition that we might want to think about is lower urinary tract disease. Summarized here, 6 different epidemiological studies from North America and from Europe looking at the prevalence of different underlying disorders with lower urinary tract disease. Single most common diagnosis is idiopathic cystitis. On average, that accounts for around about 60% of cases of FLUTD. And the 2 other common conditions are urethral plug, on average around about 18% of cats with low urinary tract disease, and urolithiasis. Again, an average of around about 14% of cats with signs of low urinary tract disease. These are all 3 conditions where increasing water intake is likely to be of benefit. Just to show you briefly, this was a study of idiopathic cystitis in cats. This was the first study, I think, that was published that demonstrated significant benefit from an intervention in managing cats with idiopathic cystitis. They looked at the recurrence of episodes of idiopathic cystitis in a group of cats over a 12-month period, fed 2 different diets. One diet was fed to 30 cats. 39% of those cats had recurrent episodes of idiopathic cystitis. The second diet, fed to a group of 24 cats, only 11% of those had recurrent signs. And the difference between those 2 diets essentially was that one was a dry diet and one was a wet diet. They were both formulated to be acidifying lower urinary tract diets. The wet diet, consumption of the wet diet, resulted in a lower, significantly lower rate of recurrence of disease and a significantly lower urine-specific gravity in the cats. And that led on to the commonly used recommendation that we should be trying to increase water intake in cats with idiopathic cystitis, because that may have medical benefits in this particular condition. When it comes to urolithiasis, we know that struvite and oxalate stones account for the vast majority of uroliths that are encountered in cats, probably 90% or more. And urethral plugs also are worthy of mention. They have a complex pathogenesis. There may be overlap to an extent between idiopathic cystitis and urolithiasis with urethral plugs. Many of these are composed of a matrix plug, which is primarily proteinaceous material, but it is very, very common to have struvite crystals as part of that urethral plug. So struvite crystals don't cause the obstruction, but they may contribute to it. And so with both of these conditions, we are thinking about crystalloid material in the urine. Now, the development of uroliths is a complex process, going from nucleation of crystals through growth of those crystals, aggregation of the crystals together, and retention of those crystals within the urinary tract. And that's a complex process. Critical to all of that is supersaturation of the urine with crystalloids. If the urine isn't supersaturated, those crystalloids are simply not going to form. So supersaturation is needed for formation and growth, and that's a common situation in cats. Many cats live with supersaturated urine perfectly happily. There's no problem with that in and of itself, but when we get urolithiasis developing, or where we have urethral obstruction with struvite crystals, then we want to try and avoid those crystals forming. How can we do that? Well, our goal is simply to undersaturate the urine, to reduce the saturation of those crystalloid materials in the urine. That can be achieved quite nicely for struvite crystals, so we know that we can dissolve struvite uroliths as well as have diets that will prevent recurrence. For calcium oxalate, it's impossible to undersaturate the urine, but we can get it down into the low metastable range, which means that crystals should not continue to grow. So we may need to surgically remove existing uroliths, but we should be able to prevent recurrence in many cases. Again, where all else is equal, clearly feeding a diet that has a higher moisture content is going to be better, a wet diet rather than a dry diet. Increasing water intake, just as in humans with urolithiasis, increasing water intake to try and produce a more dilute urine, a less concentrated urine, is a critical part of the management of this condition. Third disease or disease category worthy of mention would be diabetes mellitus. Again, a relatively common condition in cats. We know that the risk for diabetes, again, is age-related. We start to see an increased risk after about 6 years of age, get quite a marked increased risk after about 9 to 10 years of age. And the overall prevalence of this condition in first opinion practice is generally around 0.5 to 1% of cases that come into first opinion practice. When it comes to diabetes, this is a diet-responsive disease, not a diet-induced disease, but we know, again, there is an obligatory diuresis that occurs with diabetes mellitus. It's a glucose-induced diuresis. Again, the ISFM produced guidelines on the practical management of diabetes in cats, and part of that was the approach to dietary management. So they recommended that we need to avoid and arrest pathological weight loss, which can occur with diabetes. We need to correct obesity if it's present. We need to think about dietary constituents and perhaps a low carbohydrate diet, which would help in the management of this disease, but also, again, feeding a wet food rather than a dry food where possible to try and help maintain hydration. So again, another condition where water intake is an important consideration. And the last of the big conditions, I think, is perhaps constipation in the cat. Again, this is a common problem. We're all familiar with constipation. as a clinical problem in cats, that may occur for a wide variety of different causes. Obstruction in the colon or around the colon, metabolic diseases or endocrine diseases. It may simply be associated with pain because it's painful to defecate because of osteoarthritis, because of anorectal disease, etc. Maybe underlying neuromuscular disease. But diet and environment is also important with this disease as well. Again, we won't go into the details here, but things like exercise can be valuable. Things like appropriate litter box, the size, the substrate that we're using in the litter box, the number of litter boxes that are available. All of these things are important in helping encourage the cat to defecate frequently. But when it comes to diet, along with things like fiber in the diet, increasing water intake, using a wet food rather than a dry food, and trying to increase water intake is, again, a really important goal, because many of these cats may have recurrent constipation, at least in part because of dehydration or marginal dehydration, that hypohydration that we talked about earlier on. And there are other diseases as well. Other diseases which are associated with increased diuresis or increased water loss. And you could come up with a long list. I've listed some of them on the slide here. Things like diarrhea. Severe diarrhea would result in excess water loss, hypothyroidism, hypercalcemia, diabetes insipidus, and so on. The list is a long one, but there are many conditions where ideally we want to think about increasing water intake as a part of the management of that disease. How do we do that? Well, we've talked about the use of a wet diet rather than a dry diet, potentially adding water to the diet as well. Beyond that, there is little hard data, in fact, on how we can increase total water intake in cats. There is a lot of speculation and theories about water bowls, the number of water bowls that we have available, the size of the water bowl, whether that makes a difference, the depth of the water bowl, whether the water bowl is full to the brim, so the cat doesn't have to stoop down low to get access to the water, the type of bowl, ceramic or metal versus plastic, the position of the bowls, close to feeding bowls or separate from feeding bowls. A lot of speculation about this, but no hard data to say what is actually best for cats. Again, the type of water that's available, whether that is pond water or tap water, flavored waters. Again, this is pure speculation, although there is some evidence of individual preference with cats, as you would probably expect. The other thing is whether we offer moving water or still water, and the use of drinking fountains. There's been a couple of studies that have looked at drinking fountains and the use of moving water. They failed to show in either of those studies a significant increase in total water intake in cats offered drinking fountains. Both of those studies, in fact, showed that there was a tendency for increased water intake. So it may simply be that they didn't look at enough cats, or again, this may be partly individual variation. But the bottom line is, at the moment, feeding a wet food rather than a dry food is probably going to be the fundamental recommendation for increasing total water intake. There may be some situations where moderate addition of salt to the diet may be valuable in increasing water intake, but perhaps looking at other ways of encouraging the cat to take more water. And there will be another presentation looking at some newer ideas on this, how we might be able to approach encouraging greater water intake from cats. So thank you very much for listening. I hope that's been a useful summary to you. It's a very brief overview, but clearly there are many conditions where we do need to be mindful of hydration in cats and maintaining optimal hydration. Thank you.